Narcolepsy causes, symptoms, and treatment. Narcolepsy is a chronic sleep disorder that is characterized by excessive daytime sleepiness and sudden brief episodes of muscle weaknesses or cataplexy. It can also cause hallucinations and sleep paralysis. Narcolepsy can have a significant impact on a person's quality of life. The exact cause of narcolepsy is unknown, but it is believed to be caused by a combination of factors, including genetics and autoimmune disorders. Narcolepsy is thought to be caused by a deficiency of the brain chemical hypocretin. There's no cure for narcolepsy, but there are treatments that can help people manage the condition and reduce its impact on the quality of life. If you think you may have narcolepsy, it's important to see a doctor so that you can receive proper diagnosis and treatment. In this video, we'll discuss the causes, symptoms, and treatment of narcolepsy. So watch till the end, and if you haven't liked this video yet, be sure to like it and subscribe to our channel so you don't miss any further videos. The causes of narcolepsy. Family history. Narcolepsy is a chronic sleep disorder that is caused by a dysfunction of the brain's ability to regulate sleep. Narcolepsy can run in families, which suggests that it has a genetic component. Family history is one of the risk factors for narcolepsy. If you have narcolepsy, it's likely that one or more of your close relatives also have the condition. This is because narcolepsy is thought to be caused by an inherited vulnerability to developing the condition. In other words, narcolepsy is not contagious, but it can be passed down from one generation to the next. Autoimmune disorders. Autoimmune disorders are a leading cause of narcolepsy. Studies have shown that narcolepsy is caused by an autoimmune response to a protein called hypocretin. When the body attacks and destroys hypocretin, it results in a loss of the ability to regulate sleep. This can lead to excessive daytime sleepiness, even sudden onset sleep attacks. There are a variety of autoimmune disorders that can cause narcolepsy, including celiac disease, lupus, and rheumatoid arthritis. If you have narcolepsy, it's important to talk to your doctor about the possibility that it is caused by an autoimmune disorder. Infections. Although the exact cause of narcolepsy is unknown, infections are one possible cause. This is because narcolepsy has been linked to infections such as streptococcal pneumonia and influenza. It is thought that the infections trigger an autoimmune response that attacks the brain cells that produce the sleep hormone hypocretin. This damage to the brain cells can cause narcolepsy. Trauma. There are several theories as to why trauma may trigger narcolepsy. One theory is that trauma damages the part of the brain that controls sleep. This part of the brain, called the hypothalamus, is responsible for regulating many of the body's functions, including sleep. Damage to the hypothalamus can therefore lead to sleep problems. Another theory is that trauma causes the body to produce too much of a chemical called hypocretin. This chemical is responsible for regulating sleep. Too much or too little of this chemical can lead to sleep problems. Trauma may cause the body to produce too much hypocretin, leading to narcolepsy. Tumors. The study found that people with narcolepsy were more likely to have tumors in their pituitary glands. The pituitary gland is a small gland in the brain that helps to regulate sleep. The study authors believe that the tumors may cause the pituitary gland to be dysfunctional, leading to narcolepsy. Genetics. Genetics is thought to play a role in narcolepsy, as the condition is more common in people who have family members with the disorder. Although the exact cause of narcolepsy is unknown, it is believed that the cause of the combination of genetics and environmental factors. Neurological disorders. Narcolepsy is a sleep disorder that is often caused by neurological disorders, such as Parkinson's disease or Alzheimer's disease. Narcolepsy can cause a person to fall asleep suddenly and without warning. It can also cause a person to have vivid dreams and sleep paralysis. Symptoms of narcolepsy. Excessive daytime sleepiness. Excessive daytime sleepiness, or EDS, is a symptom of narcolepsy, a neurological disorder that affects the brain's ability to control sleep. Narcolepsy can cause EDS, which is characterized by an overwhelming urge to sleep during the daytime. EDS can be extremely disruptive to daily life. It can also make it difficult to focus on work, school, or other activities. If you think you may be suffering from EDS, it's important to talk to your doctor. Narcolepsy is a serious condition that can severely impair your quality of life. However, with proper treatment, many people with narcolepsy can live normal, productive lives. Cataplexy. Cataplexy is a symptom of narcolepsy that can occur at any time, but is most likely to occur during times of emotional stress, such as laughter or anger. When it occurs, it can cause a sudden loss of muscle tone that can result in a person collapsing. Although cataplexy is not life-threatening, it can be very frightening and can have a significant impact on a person's quality of life. People with narcolepsy often avoid activities that may trigger an episode of cataplexy, such as social gatherings, because they're afraid of having an attack in public. Sleep paralysis. Sleep paralysis is a symptom of narcolepsy, a neurological disorder that affects the brain's ability to control sleep. Narcolepsy is a chronic condition that can cause excessive daytime sleepiness and intermittent episodes of sleep paralysis. Sleep paralysis occurs when the brain is unable to transition from wakefulness to sleep, or from sleep to wakefulness. This can happen when a person is falling asleep or waking up. During an episode of sleep paralysis, a person may feel like they are paralyzed and unable to move. One of the most distinctive symptoms of narcolepsy is something called a sleep attack. A sleep attack is an overwhelming urge to sleep that can come on suddenly and without warning. Sleep attacks can happen at any time, day or night. They can last for a few minutes or several hours. Sleep attacks can be very frightening, especially if you're not familiar with narcolepsy. If you experience a sleep attack, it's important to try to stay calm and get to a safe place where you can lie down and sleep. There are medications and other treatments that can help control sleep attacks and other symptoms of narcolepsy. Treatments of narcolepsy. Modafinil. Modafinil is a medication used to treat narcolepsy, a condition characterized by excessive daytime sleepiness. It is a wakefulness-promoting agent that increases alertness and reduces fatigue. Modafinil is also used by shift workers and people who work long hours to help them stay awake and alert. The medication is effective in treating narcolepsy and is considered safe and well-tolerated medication. Modafinil works by increasing the levels of certain neurotransmitters in the brain, which results in increased alertness and wakefulness. Stimulants. According to the National Sleep Foundation, stimulants are the most commonly prescribed treatments for narcolepsy. Stimulants help reduce the symptoms of narcolepsy by increasing wakefulness and alertness. There are two main types of stimulants: amphetamine-like stimulants and methylphenidate-like stimulants. Amphetamine-like stimulants, such as Adderall and Dexedrine, work by increasing the levels of neurotransmitter dopamine in the brain. Methylphenidate-like stimulants, such as Ritalin and Concerta, work by increasing the level of neurotransmitter norepinephrine in the brain. Both types of stimulants are effective at treating narcolepsy. Tricyclic antidepressants. Tricyclic antidepressants, or CTAs, are a class of drugs that are typically used to treat depression. However, recent studies have shown that TCAs can also be effective in treating narcolepsy. Narcolepsy is a sleep disorder that causes excessive daytime sleepiness and can be very disruptive to a person's daily life. TCAs work by inhibiting the reuptake of norepinephrine and serotonin in the brain. This action increases the level of neurotransmitters in the brain, which lead to improved mood and increased alertness. Monoamine oxidase inhibitors. Monoamine oxidase inhibitors, or MAOIs, are a class of medications that are used to treat narcolepsy. MAOIs work by inhibiting the activity of monoamine oxidase, an enzyme that breaks down certain neurotransmitters in the brain. This action increases the levels of certain neurotransmitters, which can help to improve wakefulness and decrease sleepiness in people with narcolepsy. MAOIs are typically used when other treatment options such as stimulants have not been effective. MAOIs can be effective in treating narcolepsy, but they can also cause serious side effects. Because of this, MAOIs are typically only used as a last resort. If you're considering using monoamine oxidase inhibitors treatment for narcolepsy, be sure to discuss the risks and benefits with your doctor. Sodium oxybate. Sodium oxybate is a medication used to treat narcolepsy, a disorder that causes excessive daytime sleepiness. It is a certain nervous system depressant, meaning it slows down the brain and nervous system. Because it has the potential to be abused or lead to dependence, it is a federally controlled substance. Sodium oxybate is available only by prescription and must be taken under supervision of a healthcare provider. Pitolisant. Pitolisant, or brand name Wakix, is a medication used to treat narcolepsy. It belongs to a class of drugs called histamine receptor antagonists. Pitolisant is thought to work by reducing the amount of histamine in the brain, which helps to promote wakefulness. Pitolisant is approved by use in adults with narcolepsy. It is available in tablet form and is taken by mouth once daily. Common side effects of pitolisant include headache, nausea, and dizziness. Pitolisant is a new medication for the treatment of narcolepsy. It is not yet available in all countries. Speak to your doctor if you're interested in trying this medication. Lifestyle changes. Lifestyle changes are an important way of treating narcolepsy. You will need to make some adjustments in the way you live to help manage your symptoms. These changes can be difficult, but they are often effective in treating narcolepsy. Some lifestyle changes that can help treat narcolepsy include: stick to a regular sleep schedule, get enough sleep each night, avoid caffeine and alcohol, exercise regularly, avoid trigger foods and drinks. Making these lifestyle changes can be daunting, but it's important to remember that you are not alone. There are many resources available to help you make the changes you need to improve your sleep. Narcolepsy is a serious condition that can have a profound impact on a person's life. The good news is that narcolepsy is treatable, and there are many resources available to help people manage their condition. If you or someone you know has narcolepsy, please seek out the help of a qualified medical professional. If you enjoyed the video, be sure to like and subscribe to our channel so you don't miss any future videos. And share your thoughts in the comments section below. Thanks for watching.